Hello, I'm Dr. John Marlowe. Did you know that neck pain, headaches, and migraines are interrelated and can be helped by chiropractic care? I'm going to talk to you about that today, but first I want to tell you about the first chiropractic adjustment. Way back in 1895, there was a doctor, his name is David Daniel Palmer, from Davenport, Iowa, and he was teaching in a school, and a janitor came up to him. The janitor had a neck problem for 17 years and a hearing disorder, to the point where he was actually crooked over, bent over in his neck in a certain position. And Dr. Palmer was studying the relationship of the neck and the spinal column, also the relationship with the nervous system. So he performed 3 chiropractic adjustments on this person. And within 3 days, his hearing was restored and his neck was restored. This is a fact. You can look it up online. This is something, even though it may not be completely related to headaches itself, it's related to the cervical spine. And I have a model right here I want to talk to you about. So this is the cervical spine. There are 7 cervical vertebrae. After the 7 cervical vertebrae, we have 12 thoracic vertebrae behind that, and then 5 lumbar vertebrae. Typically, with spinal-related headaches, migraines such as that, or cluster headaches, you've heard of some of these terms before. It's usually related to the upper cervical vertebrae. And right here you can actually see the vertebral artery stemming across the back of the skull right in here, and all the way down the column here of the cervical spine. Many times I will find in my patients that the upper cervical vertebrae, C1 they call it, you've heard of that possibly. They also call it the atlas, which the atlas holds up the spine, the head, and everything else. The second vertebrae is called the axis. So C1 atlas, C2 axis. Usually those 2 vertebrae are either counter-rotated or one's ipsilateral rotation, meaning it's all on one side sometimes, but usually rotated like that. And so chiropractic care, adjustments to the upper cervical vertebrae helps a lot of people. In fact, today, this very day today, I had a patient come in to me, and this patient was suffering from severe headaches and trigeminal neuralgia. You've probably heard of something like that before. So he had a pinched nerve, and immediately I adjusted his upper cervical vertebrae, and he was astonished. He was fine. He walked out perfectly. So it does work. Chiropractic care can work in a variety of ways. Besides the adjustments, we do other things too. I want to tell you that we also do modalities or therapies such as ultrasound, soft tissue massage along the cervical area. It is one of my favorite things to treat, believe it or not. I mean, every chiropractor has something that they love to treat. And the cervical spine is just where I feel I shine the most. I just love working on the neck. I love to relieve headaches. The other thing that I know of is that we do certain points, pressure points. They would be considered acupuncture points. I do know those, what they call meridians, too, to help relieve a lot of the headaches and pressure. Also, I see people that have actual, like if they had a car accident or a whiplash injury, like a slip and fall, a lot of times that jostles things around and they have problems with neck pain, headaches, arm pain, loss of range of motion. Those people get fantastic relief from chiropractic care. I enjoy working on those people as well, and after the adjustments, most times people are feeling, if they're not 100%, they're at least 50 to 75% better. Sometimes I may have to see them a few more times just to make sure the alignment is proper and things are functioning well and their range of motion is improved. But most people get results in a few visits, so that's what we aim to do. That's our goal, is to get you results as quick as possible. I also want to talk to you about tension headaches. Tension headaches, stress headaches, related headaches of that nature, Very, very common. Almost every day that someone is coming in with neck pain and headaches. So we treat those as well as the migraine types, the cluster types of headaches, and people get excellent results from a lot of the work that we perform here at the office. I will use those acupuncture points. I will do soft tissue massage. Primarily we'll do the adjustment and the stretching exercises. Also, we need to implement those here and at home. Those are very critical for long-term relief, so you don't have these problems in the future. So that would be very good. We also should probably look at someone's diet and find out what they are, eating throughout the day, because a lot of foods create allergies, and that can trigger headaches and migraines as well. So we're going to maybe look at that and see what's going on with your diet as well. There's a few things that we can actually prescribe, herbal supplements that I have. If you want me to order those as well, we have a very good company that we get our vitamins and minerals from that can help relieve a lot of these symptoms as well as at home. You can perform your stretching exercises, your diet, and your nutrition, and that's what we can do to help you out. I do want to talk to you a little bit more about posture. I do have a video that I have done this before, but I just want to say a little bit something about posture. Now, this is the overall spinal column itself, back of the head. Here's the cervical spine. As you can kind of see, it should be a little bit called concave like that. This is a concave type of curve in there. That's the natural curve that it should be. The head should be about like that, and it should be just about like that. That's more of a normal cervical curve, okay? And then we have this one that goes the opposite way. It's called convex. It's a convex curve. This is where the thoracic curve is. The cervical curve is concave. The thoracic curve, meaning T1 through T12, the thoracic curve is convex. And then again in the lumbar spine, you can see that it shifts again to the concave portion, and then the sacrum itself, they call this the sacrum, and the pelvis actually go back again the opposite way. So every day I check people, and a lot of people are looking more like this. They're more stressed, maybe tension, because there's cervical. You have to understand that there's muscles that are attached all the way through the spine itself. And when they are under stress, a lot of times they can pull the spine into a position like this. And now this person has the weight of their head on top of the spine like this, causing all kinds of compression, and that causes the misalignments to occur, which trigger the migraine type of headaches, the tension headaches, and things of that nature, even a loss of range of motion, or dizziness, or some of these other symptoms. So if you are experiencing this, I want to make sure that you go to your local chiropractor, because they can relieve a lot of these symptoms that are occurring by readjusting these areas that are necessary. I have a video on posture and ergonomics. Go check it out on my channel. If you have any questions, please leave comments below. Regarding the cervical spine, thoracic spine, I'm going to be evaluating the curves. After adjustments, we're going to talk about maybe some stretches to help, continue that vein of having the concavity as best as possible, and the convexity here as best as possible. So we'll do some stretching exercise to help your range of motion, improve your range of motion. A lot of times I can most certainly help with that range of motion in office, and you can do some of these exercises out of the office as well. You need to do both. So we want to bring your shoulders back, because most times people over time kind of roll their shoulders forward. That's putting all that pressure on the head, neck, spine, causing a lot of the symptoms. I'll do some soft tissue massage in there and some stretches to help restore the natural curve in there as best as we can. And then outside the office, I have the stretches as well printed out that you can take home and do these exercises and stretches at home to keep things in as best as possible in normal alignment. So also I want to talk to you just briefly about vertigo and headaches as well, and neck pain. They are kind of interrelated. So a lot of times people come in Not just with neck pain, they may have the headaches. They also may have what they call vertigo. What is vertigo? Well, vertigo could be caused by a variety of things. Besides a misalignment, sometimes there's crystals in the inner ear that are lodged in the canal itself. And so there's actually tests to perform that I know that I can do to check you out, see if you have this benign vertigo. So if there is a positive test, I can help relieve that by positional changes that I do on my table here. Also, believe it or not, chiropractic adjustments. If the vertigo is not bad and it's not caused by a crystal that's stuck in the canal, a lot of times the upper cervical vertebrae being adjusted, the quick movement itself will help that vertigo. I've had this a number of times happen in my practice. Recently, I had a lady to come in, probably 3 or 4 treatments, and no more vertigo. She called back and didn't need to come in. Well, that's the type of people we want to see. Also, I had another one that was receiving acupuncture, and it wasn't really working. Of course, I'm not against acupuncture. I think it's very helpful. But I also did the spinal adjustments, and then the vertigo went away with him as well. So I'm very, very comfortable with people having neck pain, headaches, migraines, vertigo, dizziness. All of those symptoms are possibly interrelated, and I feel that I'm very well qualified to help treat these conditions. So if you are experiencing any of those symptoms, neck pain, vertigo, dizziness, headaches, variety of different types of headaches, including tension, migraine, cluster headaches, please visit your local chiropractor. If you're in the area, come and visit me. So also sinus-related headaches are one thing that I treat quite frequently, especially in the cooler months, the colder months. People come in with sinus-related headaches and neck pain, of course. So we know all the acupuncture points associated with sinus relief, sinus pressure points. I do those every day in my office. I'm working with people with sinus-related type of symptoms that we can help with chiropractic care. That's a wonderful thing that I treat every single day, and people get a lot of relief from it. As you notice behind me, I do have tropical fish. So I have 5 tanks in my office, and they keep me company all day long. All my patients who come in here admire them and comment on them. If you come into our clinic, you will experience our relaxing environment. Chiropractic care can help relieve your symptoms naturally. Please subscribe to my channel and leave your comments below.